We would like to start with our land acknowledgement. We recognize that Fraser Health provides care on the traditional, ancestral, and unceded lands of the Coast, Salish, and Inclemuc nations and is home to 32 First Nations within the Fraser Salish region. Our agenda will include information about Fraser Health. You'll hear from Fraser Health employees about their positions, and we'll go over how to apply. Just a bit about Fraser Health. We're the largest of 5 regional health authorities in British Columbia. We provide health services for nearly 2 million people in 20 diverse communities from Burnaby to Fraser Canyon and have a staff of 45,000 people plus medical staff. As you can see, we have many employees who you will hear from today about their specific roles in Fraser Health. And we would like to start off and introduce you to my colleague, Mira, who will speak to you about the new graduate program.
Thank you, Danielle. Hi, thank you for having me today, and thanks for joining. My name's Mira Inc., and I am one of the client partners for talent acquisition at Fraser Health. The reason, I guess, part of my presentation today is to talk to you about the new graduate program, which is called the Practice Transition Program for RNs and RPNs here at Fraser Health. We do offer this program to LPNs as well, but my presentation today is specifically around RNs and RPNs. So what does the program offer? It's an opportunity for RNs, RPN graduates to consolidate their registered nursing practice. So basically taking theory for students and putting it into practice. You will receive up to 121 mentorship hours, supernumerary mentorship hours. These are paid hours. There's also an additional 7.5 hours, which is also paid. It's educational time, and that is just the breakdown of what that 7.5 hours looks like. So how are you eligible for this program? So you must be a recent graduate of a Canadian RN, RPN program. You must not have worked more than 225 hours as an RN, RPN. So this does not include your clinical placements. It's RN, RPN specific experience, and no more than 1 year has elapsed since your graduation date. So when we say graduation date, it's actually your program completion date, so not your convocation date. You must also have current provisional or practicing registration with the college, with the Registering College of BC. At the time, just to note, at the time of applying to the Practice Start program or Practice Transition program, you do not need to have this in place, your registration in place. The other eligibility requirement is you currently have not participated in a new grad program with any other health authority. And the other, lastly, you must work 0.7 FTE or greater and remain in the position for at least a minimum of 6 months. So this is what the application process looks like. If you are currently employed with Fraser Health, you will actually go to your My FH info and log in, apply that way. But if you are a true external to Fraser, so never worked with Fraser Health or don't currently work for Fraser Health, you would visit our careers website. The link is there. The new grad posting, whether you're internal or external to Fraser, is 43676. You will want to create an online profile first. You can upload your resume at that time. As well, if you are internal, then as I mentioned, you would apply through My FH info. For both, please do upload a resume. Do include your clinical placements. We're looking for which site, which clinical area, the dates of your clinical placements, and also hours. And then you are ready to apply to the new grad posting. So these are the next steps. Basically, we will be reviewing your application once we receive it in talent acquisition. We do ask for 2 references. Now, if you're an external to Fraser Health, 2 references is required. You will receive an email from a company called Scale Survey. So when you do hopefully it doesn't go into your spam, but do check spam. And we would be asking for one reference from your final clinical instructor and one from your final clinical preceptor. Now, if you have ESN with us, so if you were an employed student nurse with Fraser Health, we would only require one reference, and that would be from your final clinical preceptor. Lastly, the interviews would be conducted. So a hiring manager would contact you directly to set up an interview. Now, these interviews could either be in person or virtually, and it could be one-to-one or with a panel. So some new grad opportunities or education opportunities, you could also be a mentor or preceptor yourself. You'll have clinical nurse educator opportunities. There may also be management leadership opportunities, so perhaps a patient care coordinator, PCC, manager for clinical operations. We do also offer specialty education opportunities. So those, the next slide will just show you what areas we offer specialty education. And I won't go too much into detail as far as what those specialty areas look like, because later on we'll have presenters speaking to that. So there could be critical care, emergency, high acuity, neonatal, pediatrics, PACU, periop, just to name a few. Also, there are new grad specialty areas. So if you are interested, we do look at where have you completed your final clinical placement? Where were you an employed student nurse? But do keep in mind that in all the areas, you don't need to have a final clinical placement or ESN experience, like it might not be required. So I wouldn't hesitate to not put that option in. So when you do apply, do indicate which specialty area you would be interested in. We also have something called transition opportunities or transition lines. And basically what these are, they're available in various specialty units. And what that looks like is it's basically you working in a position that you're not 100% fully qualified. So I can give you ER as an example. Because you're not a full-fledged ER nurse, you would be working this transition line, say general medicine duties in the ER, so in an ER setting, until a specialty seat becomes available. So you would be willing to go through specialty education with us. It's 100% employer paid until a seat becomes available for a specialty education. And that concludes my presentation. I'm going to actually move it back to Danielle. Thank you.
Great, thanks, Mira. Now over to Nolene, our Clinical Operations Manager in Medicine.
Hey everyone, thank you for joining this morning, and thank you, Nour, for outlining the new grad program. I think it's a wonderful offering for Fraser Health and kind of ties right into the medical surgical programs that I'm going to speak to today, as we do a lot of our new grads through that program. So a little bit about kind of where I came from and what I do. And so I myself have a nursing background. And so speaking to Mira's way of growth for pathway and leadership, through Fraser Health, I was able to grow my career and take on some leadership roles and end up in the clinical manager role. So I think that's a really good, unique opportunity to highlight within Fraser Health. So currently I do a medical and surgical unit as one of the areas that I manage. Part of that is the daily operations. So how, access and flow patients in and out, ensuring that we deliver quality care to our patients. And so all Fraser Health sites have a commitment to our quality, and it's integrated into our care, our processes, our systems, and it's being, we pair with our regional team to help with those initiatives. For example, I'm at Eagle Ridge Hospital. We were one of the first areas to launch our electronic medical record, our EMR, so Meditech Advance, and our sister sites, Mission and Fraser Canyon, have gone live. And then now one of our first tertiary sites at Royal Columbian has also joined us using electronic medical records. So one of the ways that we are growing within our region and making sure that we are delivering that quality of care. We also, participate in, like I said, site-wide initiatives as well as regional initiatives. Often you'll see them in our medical and surgical program, as it's just a unique population and a wide range of variety of illnesses and diagnoses to help with these initiatives. One, for example, I'll speak to is we're working on a sepsis bundle through AI, which is incorporating the Meditech and the electronic charting. And so highlighting just how we are serving our patient population with some of the tools that we have. I want to just really speak to quick about the medicine surgical units coming into into Fraser Health, and highlight that our programs have changed as our populations have changed. And so there is a unique ability to care for your community within all the Fraser Health sites, depending on either where you live or if you want to travel and work in a more specialized area. From the area that I own at the general surgical program, but there's always opportunity to explore what you're interested and find an area that aligns. And interesting is you may not even know what is aligning or what you want to do, but you come across that one patient or that one shift or that interesting or cool surgery, and that really builds that pipeline to what you want to do. So I encourage everyone to explore what they're comfortable with, and then push the boundaries with what they're not, and keep learning, because nursing is a lifelong learning profession, and this is how we support it, by having all these areas available to you to really find that niche.
Fabulous. Thank you, Nolene. Nour can speak about the emergency room.
Hey everybody, can you hear me okay?
Yes.
Awesome. I have been working with Fraser Health for about 7 years now. I'm currently working in Surrey Memorial Emergency, and I've worked across many emergency departments in the region. However, most of them have been in Surrey. I've completed different levels of training within emergency, from the specialty training, trauma training, triage training. And now most recently, I just started as the RN mentor for our department. So my new goal would be supporting our new grads, transition nurses, and both RNs and LPNs with their transition into our department. I love working in emergency. It's always been the love of my life ever since I started nursing. Mostly because it's always interesting. You never know what's going to come in through the door. You never really know what's going to happen or how your day is going to be like. It keeps you on your toes. You're using a lot of different variety of skills. You're working with a multidisciplinary team, whether your doctors and your RTs. We're working very closely together, and I just love that variety. And it's always interesting, and we're always learning and growing. And Surrey, especially, I'm really biased because I love my team and they have been fantastic. So that's just my short and quick spiel about emergency, and we'll see if her mic is working now.
Great. Thanks so much. Karen, can you just go to the previous slide? I think Maria should be able to unmute her mic. And sorry about that, Maria.
No problem. Can you hear me?
Yes.
Excellent. Hi, my name is Maria. I've been working in Surrey Memorial Hospital for about 9 years now. I started actually as a new grad nurse. I did the transition line and the specialty program. I did the emergency program. I've been in Surrey ever since. It's one of my favorite places to work. It's such an exciting and big department. We are the biggest emergency department in Western Canada, and of course the busiest. So we have our unique challenges, but we also have our unique staff. I really enjoy the multitude of opportunities that are available for us in emergency. I think that it's definitely a place that's not boring, and if you're willing to be surprised every single day, it's a really great place to work. It's never dull. I do love the fast-paced environment, and that's why I've stuck around. And yeah, my background is community mental health, and I got into nursing completely by accident. I actually got hired in Surrey Memorial Hospital because of a friend, and I ended up staying here because I love the team so much. We do have a ton of amazing opportunities here. A lot of us have started our career as new grads and then transitioned to specialty training, then doing our trauma training, triage training, and then all of the other bits, mentorship as well. So that's really fun too. And we have a very close community. Surrey Memorial Hospital, and we love our new grads. Yeah, thanks.
Thank you so much, Maria. Karen, I think we're now on to Bailey from the emergency room as well.
Hi, perfect. Thank you. Sorry about that. My name is Bailey. I'm one of the ER nurses at Surrey Memorial Hospital as well. I'm also one of the co-leaders of our quality improvement team. I began my career in the ER as an ESN in 2020. I then graduated in 2022 and completed my new grad hours. I most recently finished my ERQ specialty this past December. As an ER nurse, you're often the first hospital care providers to see patients and shape their healthcare experience, which can determine if they seek healthcare in the future, which I think is quite special. We see all patients that come through the hospital, which has given me a well-rounded experience and foundation. ER nurses are basically general experts in every specialty. Working in the ER, I've learned how to detect sick and deteriorating patients. Because we work in traumas, go to hospital codes, and often have patients who are about to go into cardiac arrest, we often get to do big interventions for high reward, meaning you can be administering high alert critical care meds or assisting with invasive procedures and can see that direct impact fairly quickly in patient status. Growing up as a nurse in the ER has also taught me to nurse at a fast-paced level. I love ER nursing because there's so much teamwork involved. I've always found the team, including floor staff and leadership, to be very supportive, and it's always felt like a safe place to learn and grow as a nurse. There are so many different assignments and zones as well that no day is the same in the ER, so it's very unlikely you'll get bored and you get a wide variety of experience. To touch on the quality improvement team, we have this committee in the ER focused on making positive change for staff and patient experience. You can join and help be part of the change as well that you want to see and that it directly impacts you and your patients. For example, we helped roll out the Ensure program to give patients above the age of 60 Ensure twice a day, and that was shown to decrease hospital length of stay. We also do social events, candygrams, etc. Thank you.
Thank you, Bailey. Now over to Crystal.
Hi, everybody. My name is Crystal Sutton, and I'm the manager for Surrey Memorial Pediatric Emergency Department, as well as the Forensic Nursing Services in Fraser Health and Surrey Satellite Clinic. So my role is to oversee operations under my portfolio, ensure safe practice. We also have a robust quality improvement committee here at Surrey Pediatric Emergency. We also have branched into a nice social committee, so lots of staff are really engaged in making this a positive work culture. I often hear from ESNs and new grads who attend our department that it is one of the best that they've ever stepped foot in, and that's why we have such great retention in our department. I also work on culture building, as I alluded to, budgeting, and engaging with community stakeholders in my various portfolios. So what I love most is just being able to lead, honestly, such an incredible group of professionals and knowing that we truly make a difference in the community we serve. So Pediatric Emergency, we are the only emergency in Fraser Health that actually has a dedicated pediatric emergency. We see more pediatric patients than BC Children's does, so we are very busy. We are a small 12-bed department with a fast track area. We also currently have an expansion and we are undergoing redevelopment. So in the next foreseeable future, we don't have a date yet, but we will be expanding into a full new critical care tower that is PEDS dedicated. So what we're hoping there is it will rival BC Children's in its size, because we do have a lot of families out in the lower mainland versus in the city. We all know affordability these days and where we live. So a lot of people travel to us because we are known as the best in PEDS care. However, all emergency departments can service pediatrics. So that is one thing to look forward for our program. If you're also interested in forensic nursing services, so it isn't psych nursing, it's not CSI. So what it is we service those patients that have been sexually assaulted. We also see child maltreatment. We do elderly abuse, and we also see interpersonal violence patients or patients that have experienced violence in some capacity. We do have a focus on our Indigenous population that makes up a large portion of that, and we are currently working on expanding this program to a mobile outreach to all hospitals to be more trauma informed. So that's also a really neat niche program. We do have a Surrey satellite clinic, which really operates in decanting our lower CTAS patients from our emergency department. So what that does is it basically takes the walking wounded, those that are appropriate to be seen in a clinic or a family doctor's office, but they just can't get in a timely manner. So this is serviced right across the street from Surrey Memorial Hospital. We work out of the Wally UPCC. We are the first hospital to be able to do this. I know Eagle Ridge also and other hospitals are expanding. We service about 100 patients a day through that clinic. So again, lower CTAS, we have RNs, LPNs, and unit clerks working out of there. And it is also a nice place to work. So that's a little bit about our community and opportunities for you. Thank you.
Thank you, Crystal. Now over to Peter, our clinical nurse educator in emergency.
Hi there. Yeah, my name is Peter. I am one of the 3 clinical nurse educators at Surrey Memorial. I've been at Surrey Memorial my whole career. I've been here about 14 years now. I started off as a new grad in the Emerge. I really love mentoring and teaching staff and challenging their critical thinking. I made it really made an effort to be a good knowledge source for staff. So naturally, when there was an opening for the C&E role, just over 2 years ago, I made the jump. Part of my role is to, obviously provide education and updates, provide orientation to new staff or staff who have transitioned their skill set, provide clinical support, so helping staff out with skills. I also play a role in clinical policy development. It's definitely not the most exciting thing out there, but it helps ensure our policies are up to date or created if they don't exist. I also help organize and run simulations and provide in-services to staff about new equipment, practices, and policies, and any new changes. So lastly, I just want to talk quickly about why I still choose to work at one of Canada's busiest emergencies, and that's because of the team here. We have such an amazing team here. We all support one another and care not only for the patients, but for each other. Thank you.
Thank you, Peter. And over to Fidelma, a clinical nurse educator for the critical care program.
Good morning, welcome, and thank you for being here. It was a dawn of time when I decided I wanted to go into critical care. My big plan was to stay in ICU for 2 years and try a different specialty. Well, that was more than 25 years ago, and here we are. I was trained in-house at RCH, and I started as a bedside nurse in ICU. I remember driving in for shifts praying my patient would be a no code, as I was so afraid I would not know what to do if they coded. But the thing about ICU patients is they do code, and it was okay. I did know what to do, and the whole team was there to help. As I gained experience and knowledge, my skills in ICU expanded. My roles expanded as well. Every shift brought new adventure, challenges, and learning opportunities. Trying to find where I ultimately fit into my role, I took many temp roles in ICU as CNE, CRN, and charge nurse. Nothing made me happier than sharing my knowledge with students and new staff that came my way. I dedicated my professional career to staying at the forefront of excellence in critical care at RCH. This has included many out-of-country conferences that were funded by RCH. After a while, I became restless. What more could I learn and what else could I do? I set my sights on the cardiac surgery ICU and spent 5 years refining a whole new set of skills. CSICU is an amazing place to work, but I missed ICU. It was where I belonged. About that time, COVID hit and turned all our worlds upside down. I returned to ICU to help care for these patients. One PCC said to me, "Welcome home, we missed you." That hit me hard. It was home, it's where I'm supposed to be. These are my humans, my family, my home. As I resettled into ICU amongst the chaos, the unknown, the PPE, and the 7 p.m. cheer, I knew it was decision time. We had team nursing, and my love of sharing my knowledge and support reemerged. It was hard to see the eager eyes behind the eye protection and face shields, but it was there. We learned a lot about each other during this time, and that being just okay is okay. I saw the need for balance, balance between home and work, between professional and personal. As our COVID numbers declined, I went back to CSICU, but I was restless again. As I was deciding what to do, the most incredible opportunity came up, creating an in-house critical care program. That was October 2020, and we are now in our 4th successful year. I was able to use my voice and experience to design a program built for balancing life, education, and work. Critical care is filled with incredible moments and opportunities to make a real difference in human lives, but it comes with its fair share of gut-wrenching challenges. One of the most difficult aspects is human loss. You will be part of a family's worst day as they say goodbye to their loved one. Watching them struggle with fear, uncertainty, and heartbreak is incredibly difficult. The emotions are real and they are heavy. They can be hard to navigate, and we are taught strategies to cope. The ongoing support from the ICU team and beyond is valuable and has brought me through some difficult times. Over the years, I've watched the leadership for ICU at RCH develop strategies to support us at the bedside, and it works. We have also advocated for and successfully established transition CNEs to support new grads in critical care. While critical care nursing can be challenging, it's also a profoundly rewarding career. You'll be stepping into a world where every day is an adventure. Embrace the challenges, celebrate the victories, because there will be some incredible victories. You are making a difference in the patients and families that you care for. I've now settled into my role as clinical lead for the in-house critical care program. My position has allowed me to facilitate learning and excellence in critical care for nurses entering the program. The program is a competency-based, certified, approved training course for RNs to work in critical care. The program follows standards set by the Canadian Association of Critical Care Nurses and BCCNM. Graduates will have the foundation needed to practice successfully and competently as a novice critical care RN. Critical care practice requires careful maintenance of mental, physical, and emotional well-being. Embedded throughout the program are aspects of psychological safety and well-being. The program is designed to accommodate education-life balance. An intentional focus is placed on reflective practice, strategy sharing, and debriefing. Thank you for listening to my journey.
Thank you, Fidelma, for sharing. Now over to Niki and Meredith.
Good morning. You're actually just going to get me Niki. Meredith got caught up with patient care and she had to prioritize patients. So my name is Niki Mogadam. I'm the clinical operations manager here at ICU at Ridge Meadows Hospital. My portfolio exists of ICU as well as the inpatient surgical unit and the respiratory therapists. My journey is similarly to what has been shared all along. I started here at Fraser Health as a new grad nurse, went through the transition lines, mentorship. I found love at oncology. I worked as an oncology nurse for a long time. And then within Fraser Health, I had lots of opportunities for different leadership roles to try out and found my new passion in leadership. What I see my role as a leader is to make sure that I support my frontline staff, nurses, to ensure that they have what they need to provide the best patient care that they can, to make sure that our communities and patients' families are well looked after. We're in a smaller community hospital, so there's a lot of sense of community and family and close-knit. I actually went around and talked to our ICU nurses and asked them why they have stayed. There are a lot of opportunities across Fraser Health and why they have chosen to stay with us at our hospital. And the common theme was that it feels like family. It's the people that I love, who I work with every day. We get to work closely with other disciplines, and our physicians are amazing. There's a mutual understanding of trust and respect between nurses and physicians. And again, being the small community, you're looking after your community. It could be your family member, your loved ones that are coming through. So it is that we are serving our community and supporting and helping each other out. We're a smaller ICU in comparison to Surrey or RCH. We have 7 beds. And again, because we're so small, you get a lot of different variety of patients that come through. There's different diagnoses from just higher level of care to truly vented ICU patients that you look after. So it's a great place to build those skills, especially for a novice nurse who's coming to an ICU setting. It's not as overwhelming and stressful as some of the tertiary sites. They get to really practice and build those skills with different type of patients, and the ratios all change depending on the acuity and the type of the patient that you're looking after. Our frontline leadership, Meredith, the PCC, and Kimberly, the CNE, are amazing resources and support. They always connect with the staff every single day, and they all support each other with anything that is needed. That is all for me. And there's a few more things, like everybody has said, like the teamwork, providing, getting challenged, using skills and knowledge that you're learning through the specialty programs. And there's a lot of mentorship advancement opportunities. We work well with the within our site as well as the region for a lot of different initiatives. So you get to participate in a lot of different activities. Thanks.
Thank you, Meredith. Over to Faith, our clinical nurse educator in perioperative.
Hi, everybody. Good morning. Thank you for joining today. I am the current CNE for the Perioperative Specialty Education Program. I started this role almost a year ago, but since then I've been working as a nurse in Fraser Health since 2019. Started as a new grad on the surgical units and found that I couldn't quite find what I was looking for. I wanted the variety. I wanted more being engaged in patient care, and I just wanted to have that completion and feel like I'm rewarded with all the things that I've done for that patient's healing journey and actually being able to see it materialize in front of me. So when I had a shadow shift in the OR at RCH, I was blown away. I was like, oh my gosh, I could be working with a brain patient. I could be working with patients that need bowel surgery, need bones fixed, help deliver babies, all in one shift, 8 or 10-hour shifts. And that excitement just got me so engaged in the OR itself. I really love all of the different types of interdisciplinary teams that I work with. I don't work in a hierarchical setting next to doctors and anesthesiologists. I actually work as part of the community where I'm able to advocate for my patient and my concerns with these team members and able to be understood and responded and advocate for my patient in those settings when they're very vulnerable. We support the patient throughout their surgical care, so I see them preoperatively when they're very anxious and scared and able to give them a few kind words to help support them through their very scary journey, which some things could be ending up in the patient's going to ICU. It could be the patient going into, pardon me, patient going from just a regular appendectomy surgery and going home the next day, but just having that fear of the unknown and fear of change and being that supportive person in the OR for that patient is really rewarding. We have 2 distinct roles in the operating room as a circulating nurse and a scrub nurse, and everybody is able to do both roles. When it comes to preparation of the operating room, we are making sure that all of the required instruments, supplies, and equipment are available and ready for each case. We have a good technique when it comes to sterile technique. We have collaborative, dynamic teamwork with anesthesia, nurses, surgeons, allied health, x-ray department, lab techs, anesthesia assistants, many different scopes of knowledge and practice, which I all get to work together with. Very, very focused, specialized one-to-one patient care. Very specialized. And this picture here, there's lots of x-rays, but there's constant advancements with surgical technology in the operating room, and every day is just exciting, and I come ready to learn something new every day. And as I had mentioned before, it's just so rewarding to be such an integral part in the patient's surgical journey and actually see the whole surgery from start to finish, where my patient was previously so anxious, so worried, and then we're able to wake them up and say the surgery's done, everything's okay, we fixed whatever we needed to fix. And being a part of that care in that patient and making a difference is so rewarding, and why I love the operating room so much. Thank you.
Thank you, Faith. Let's see, next up is Jenny, our clinical nurse educator in PACU.
Hi, everyone. My name is Jenny, and I'm the CNE for PACU here at Langley. I started off at RCH as a surgical nurse and then a PAC nurse before I transitioned to this role at Langley. PACU is one of the critical care departments to work in. We serve a diverse patient population and offer a variety of surgical specialties. Our surgical department is committed to providing exceptional care across 6 different types of services: general surgery, ENT, orthopedics, plastics, urology, gynae, and we do perform the occasional cardioversions and ACTs here as well. PACU is a fast-paced environment with a high turnover rate, which means you'll constantly engage with new patients and learn continuously, keeping every day very fresh and rewarding. As a PACU nurse, you'll work alongside, like Faith said, anesthesiologists, surgeons, OR nurses, surgical nurses, fostering such a great working environment and culture of teamwork. There's also a level of autonomy in your role, allowing you to make decisions that directly impact patient care. This independence not only enhances your surgical or your nursing skills and critical thinking, but also prepares you for future leadership opportunities. Like I mentioned, you'll need critical care education, which can be completed through BCIT or our in-house Fraser Health program. We encourage professional growth and provide sponsorship opportunities for you to join the critical care program and work in PACU. Our surgical services offers a rewarding career path that combines autonomy, collaboration, and continuous learning in a dynamic setting. So, I mean, if you're interested in surgical nursing and critical care, PACU would be the best fit for you. Thank you.
Thank you, Jenny. Now over to Anita and Sonya in our MICY program.
Hi, everyone. I'm Anita, and I'm the clinical nurse educator in the NICU.
And I'm Sonya. I'm one of the CNEs here as well.
So just a little bit about us. I've been in the NICU for about 13 years. I've always been in the NICU, and I feel like I would never leave. I love it here. I started off as an RN. I've done other roles like patient care coordinator, and now I'm doing the CNE role. I teach NRP, so various things. And Sonya?
And I've been in the NICU for about 15 years. We work bedside. In the NICU here, we do work bedside, and then you do get trained to become a level 3. This is a level 3 center that we have here at Surrey. So first you do start off as a level 2 nurse. You go from a level 2 to level 3, and then you go and become a resus nurse. And there's a lot of opportunities. So I was a PCC for about 7 years until I took this CNE position and also became an NRP instructor.
So lots of opportunities in the NICU. So just about our role specifically, we determine educational priorities. So we do lots of huddles with new education or new machinery that's coming into the NICU. Things are always evolving, so there's always lots of education for the staff going on. We develop and revise educational programs based on clinical evidence, policy, literature, and resources and educational theory. We do a lot of onboarding stuff, so that entails doing the interviews, sending all the onboarding information, and just following up with our new staff, seeing how they're doing, finding out when they can go from a level 2 to a level 3, making sure they have all the resources to support them here in the NICU. Here in the NICU, we also do a lot of quality improvement projects. We currently have, I think, 3 projects going on at the same time. We're trying to improve kangaroo care. We're also trying to improve giving patients fresh milk instead of refrigerated milk. And then we're doing some stuff around lung ultrasounds. So lots of quality improvement.
And family-centered care.
Oh.
Yeah, family-centered care, that's huge, and that's a big thing that we do here in the NICU. And in the NICU, it's not just a common misconception about the NICUs that we see just premature babies, but in the NICU here, we also see a lot of term babies because they come in for various things. And we really try to promote family-centered care here, and just because it's so important for babies' development and bonding. And another part of our role is that we do review and we do a lot of orientations that we teach. So we teach the NICU regional orientation programs here in the NICU. That is different from the orientation that Fraser Health would provide for new employees. So it's a little bit more specific to the NICU population. And yeah, thank you.
Thank you, Anita and Sonya. Over to Sheena, our clinical nurse educator in our renal department.
Hi, everyone. My name is Sheena. I'm currently in the interim CNE role in hemodialysis at Surrey Memorial Hospital. A little background about me. I joined the renal team at SMH about 6 years ago after completing the nephrology specialty education program through Fraser Health and BCIT. Before that, I was working in general surgery for about 3 years before applying to the specialty education program. The nephrology program takes about 6 months to complete. There's 3 months of the theory component followed by 3 months of clinical placement in hemodialysis. So I would highly recommend the renal specialty to any nurses looking to specialize it, as it's a great environment to work in, and it also for growth of skills, knowledge, and expertise caring for kidney disease patients in the outpatient hemodialysis setting. In Fraser Health, there are 3 in-center hemodialysis sites at SMH, RCH, and ARH. Each hospital program also has community sites where patients go for dialysis. I think a common misconception about hemodialysis is that it's an area where more experienced nurses go when they're closer to retirement. At least this is what I heard when I was first considering the nephrology specialty. But working in renal, I can tell you that this isn't the case. Our renal team consists of nurses with a wide variety of experience levels. We have younger nurses who are just starting out in their careers to nurses with lots of experience. The renal unit is a fast-paced and dynamic environment. We care for a wide variety of patients with different acuity levels and comorbidities. So it's a great place to learn and to continue to grow your nursing knowledge and skills. One thing that stood out to me when I first joined the renal team was the positive culture of teamwork and supportive environment that is present on our unit. So nurses really work together, and there is always support available if someone has a busy assignment or someone is struggling with a patient. In addition, we work closely with a specialized interdisciplinary team of renal-specific pharmacists, dietitians, social workers, and nephrologists to provide quality care to our patients. So within renal, there are lots of opportunities for professional growth and development, along with working in the in-center dialysis sites. You can also work in the community dialysis sites. There are opportunities to work in the home modalities, such as PD and home hemo, and opportunities to work in pre-post-transplant and in the kidney care clinic. So there's lots of opportunities to try new things within the program itself. What I find most rewarding about being a renal nurse is knowing that I'm making a positive impact on a patient's daily life by the care that I provide. In the hemodialysis setting, we often care for chronic patients who we see multiple times a week for dialysis. When caring for these patients, we get the opportunity to build rapport with them. Over time, we get to know them as individuals outside of their dialysis treatments. And for patients living with chronic kidney disease, we know that hemodialysis is life-sustaining treatment. So These dialysis treatments allow these patients to maintain daily functioning outside of the hospital setting, whether it's being able to participate in daily activities, go to work, or spend time with their families and children. So right now is a great time to apply for nephrology specialty education, as Surrey will be increasing our intake for nurses for the upcoming spring and fall programs as we prepare for the opening of the new SMH renal unit, which is estimated to open in fall of 2025. So the new renal site is being built as a standalone building on the SMH campus. It will have an additional 21 beds, 1-to-3 nurse to patient ratio, and will have state-of-the-art equipment and facilities. As well, RCH and ARH will be expanding in the future, so it's a great time to join the team. Thank you.
Thank you, Sheena. Now over to my colleagues Judy and Patti, who will speak with you today about internationally educated nurses.
Hello, everyone. Oh my goodness, excuse me. Hello, everyone, and thank you for joining us today. My name is Judy Bright, and I'm a talent acquisition representative with Fraser Health, and I'm here today with my colleague, Patti Edler. She's a client partner, and we take care of the internationally educated nursing recruitment for Fraser Health. I look after the immigration and BCP&P process, and Patti does the initial reviewing and referral. We are very excited to be here today to speak to you and all provide you with information about Fraser Health IENs and answer some questions that you may have. We do have an IEN posting that you can apply to with questions that we need to review in order to better get to know you. Once we have reviewed the application, Patti will reach out to you to schedule a meeting to understand your experience and needs better. We look at all your experience to determine if you are qualified to work at Fraser Health. Specialty and experience in other countries is taken into consideration, but not necessarily considered equivalent to specialty qualified at Fraser Health. You can apply to transition lines in some specialties. You would not be hired necessarily into specialty nursing education. Some specialty managers may require you to have 6 months or more acute care experience in Canada prior to being considered for specialty nursing education. We work in partnership with HealthMatch BC, who will support you in the registration process as well as the immigration process, and if you are sponsored for the BC Provincial Nominee Program. Some of you may have already been in contact with HealthMatch BC. I will give you a high-level look at the hire process flow and the BCP&P process. If you're a successful applicant to a permanent full-time position greater than a 0.8 FTE with Fraser Health, and that's a nursing position, we will request a salary step placement form from you as well as a copy of your passport. If you're offered a position and your references are completed, we will provide a conditional offer letter to you with a 3-month future start date. Our onboarding team will set your salary step first as per the collective agreement, as we are a unionized employee. You will have 10 days to accept or decline the offer, and upon acceptance, we will process the BCP&P documents for you to submit to BC Provincial Nominee Program for your nomination, and there is a fee associated with the submission. Once submitted to the BCP&P program, there is a month or less turnaround to receive your nomination. Once you receive your nomination, you will need to notify us and provide a copy of the nomination as well as your work permit support letter. We will then process the employer compliance in lieu of the labour market impact assessment and forward that on to you. You will also have the support of HealthMatch BC to apply for your work permit and submit your permanent residence application to IRCC. This whole process can take 6 to 8 weeks or more to complete, and you receive a letter of introduction to come work in Canada. This is dependent on the processing time in your country of residence, and depending on your citizenship, you may be able to apply at the point of entry for your work permit. The determination of your work permit approval is at the discretion of IRCC and the border officer. Lastly, you can include your spouse or partner and dependents in your application. And thank you very much.
Wow, thank you to all of our presenters today for their very valuable and insightful information that you've provided. Next, I will introduce you to my colleague, Guggen, who will touch on how to apply to positions at Fraser Health.
Thanks, Danielle. So the first thing I'm going to go over is how to apply to Fraser Health. So you can see here there is a link, which is careers@fraserhealth.ca. That is the first kind of point that you would connect with. So you would go to our careers website. You would search the jobs by visiting the external jobs search page. You can start the search by doing, like, if there's a keyword that you're looking for, whether that be a specialty, so emergency nursing, ICU, etc. You would then look for the application, apply to it, and then the very first time that you apply to Fraser Health, you do need to create a profile. And then once you've done that, you've filled in all the mandatory information, you would submit your application. After that, we move to the next steps, which is the confirmation of that us here in talent acquisition, the external recruiters have received your application. We would check your application against the job description to make sure that you meet the qualifications. And if you do, we would put your application forward. We would approve it or put it for manager review if we're kind of, if there's some things that you're possibly missing in your application and we'd like the manager to review, we would put it under manager review status. After that, if they are interested, either the PCC, CNE, the manager themselves, sometimes they would set up an interview with you and you would be interviewed. Once you are successful in the interview, we here in talent acquisition, we would complete 2 references for you if you're an external candidate and 1 if you're an internal candidate. So why join us? So some of the really great incentives that we have here and benefits of working here at Fraser Health is that we do start off with 4 weeks of paid vacation. We have 100% employer paid health benefits for you and your family. Pension, we have the flexibility. We have also the relocation assistance, which is available for some of our difficult to fill positions. So it's 5,000 for across Canada, and it's 3,000 within BC. So you would send that at the time the recruiter would review, and we would put in an application to get you relocation assistance. We have some great top-ups, so sick leave, maternity leave. We have a transit incentive, as well as the career development, so employer paid career education and advancement programs. So next slide, I'm just going to talk a little bit about the urban and rural incentive and recruitment incentives. I'm sure this is something that you have heard about. So it's something that is being offered with all the different health authorities. We are offering $15,000 for the urban and metro areas. So these are for all our eligible nursing and health science, allied health professional positions. And then if you are in some of your rural areas, so like Hope, for example, they are offering up to $20,000. This is a signing bonus, and it comes with a return of service for 2 years. So you would come back and work in that particular unit for up to 2 years. And next thing is the relocation assistance. So a little bit more about that. It must be a regular role. There's a maximum of 5,000 for new regular full-time employees, again, that are relocating from outside BC. This has to be a position that has been difficult to fill, and the position has to have been vacant for 90 days. And the last a couple slides here is just about our social media channels. So we have quite a few social media channels. So we would encourage you to follow us to kind of keep track of what's happening here at Fraser Health and all the exciting developments that we have. So we are on Instagram, LinkedIn. You can follow us on our YouTube page where we put a lot of content on there about the different units and kind of highlighting some of the great stuff that's happening here at Fraser Health.